Good evening, everyone. Today, we've all gathered here to know and discuss more about what is geriatric care is all about. Hope all of you are doing well and staying safe. And this is a joint session organized by Midlife and Eldricare. Today, we are going to discuss about what is geriatric care is all about that we all need to know. So, we are starting our session by saying happy aging. So happy aging is nothing but getting older in a healthier way. So we're gonna cover three aspects about aging, nutrition at home, what kind of a fitness is required for elderly people to be healthy at the old age also. So a lot of us would be considering that taking care of elderly population is a very difficult task, but it is exactly not. With proper planning and coordination, we can take care of elderly people without any deformity in an effective manner. So the motto of proper elder care is to improve their quality of life and maintain their independence as long as possible. So like I mentioned, it's a process of planning and coordinating to meet the elder care goals without any physical or mental issues. So to do so, we need to meet their long-term needs, to improve their quality of life, to maintain their independence as long as possible. So who all are can give their contribution in this geriatric care? First and foremost, children and family members. So children and family members play a very important vital role because most of our elders do spend a lot of time with their families. So towards the older age, they shouldn't feel like they have left out, or the family members they need not no longer need their opinions or the feedbacks about what do they feel, what do they think. So they need to know, or they need to understand that their opinions do matter, they still exist, and they are taken care, they're loved like how they used to be loved before. So these kind of a little bit of love, care, and affection from the family members to our elderly people would make a lot of difference, so that they can feel happy, and when they are happy, their health also kind of will be a happy state. So healthcare organizations such as hospitals, geriatric care providers also play a very vital role because the medical needs of elderly people are very different from those of adults. And the field of geriatrics specializes in tending to those needs. So geriatric team focuses on taking care of the preferences and the values of older person, while also taking into consideration of their social, emotional, and medical needs while forming a care plan. So devices and other consumables, how are they going to help in our elderly people care? So these devices, assisted devices such as scans, crutches, wheelchairs, walkers, and walking sticks can be used to increase a parent's base of support and improve their balance, which will in turn increase their activity and make them feel independent. Also, quite a lot of mobile alert system available these days in the market, in which if our elderly people are in a need of a support, they just have to press that alert button, so the family member or the caretaker get an alert that the need is needed from the elderly people. This way, they feel that someone is always surrounded around them. Also, we can do provide grab bars. Fall, that is also can be taken care. Also, the community in general, when we say, so we need to the geriatric population or the people need to be allowed more socialized with the same age group, so they can discuss or talk about what are they feeling. So basically, being more communicative or being more socialized with the same age group will help them to overcome a lot of health issues. So coming back to life expectancy in India, so it is currently at 70. It was below 50 in 1970. So with the constant improvement in medical conditions and general awareness, the average life expectancy is continuously moving up. Uh, with people living longer, the definition of old is changing. 62 was the age when someone became old. Today, most people don't feel old until they are in their 80s. Additionally, being old is no longer defined just by a number, but more so by the point at which individuals begin to lose their independence. So the new saying is 80s has become the new 60s. Medically, 18 to 45 is considered as young adult, 45 to 65 as middle-aged adult, and 65 plus is considered as older-aged adult, which is geriatric age. So current geriatric population is estimated around 10%, expected to grow to 15% by 2026, expected to reach a level of 30% by 2050, and we have an alarming reach of levels of 50% by 2070. So, what are the common geriatric conditions we come across in our elderly people? So, as they grow older, their body becomes very weak, which is called frailty. So, their body becomes weak due to various reasons. They may become immunocompromised, elevated insulin intolerance, higher glucose levels, and inflammations due to other conditions. So, frailty results in reduced quality of life. There are multiple factors that contributes to this syndrome. So, which are comorbidities, cognition and mood disorders, diet and nutrition, finally, physical activities of a person. So here we are going to talk about some important factors that they acquire over the aging. So urinary incontinence is one such common problem in which they lose the bladder control. Sensory loss in which they have reduced eyesight, hearing, taste, smell, and touch. Sleeping disorder in which they'll have trouble sleeping during night. Falls, like I mentioned, which causes injuries and morbidity resulting because of the falls. Movement disorder, wherein gross and fine motor disability involvement will be there. Osteoporosis, wherein bone loss, weight, and muscle loss are involved. Psychological and cognitive issues such as isolation from the society or from any other elements, and cognitive issues such as delirium and dementias are some of the common problems. Other than these problems, there are some of the common medical conditions also, which are cardiovascular condition, endocrine disorders such as hypertension and diabetes are also common geriatric conditions, and renal disorder, cancer, and arthritis. So, a good management of these diseases and skeletal muscular rigidity helps in avoiding most of the problems mentioned in this list. Having two conditions indicate frailty, and there are three or more indicates frailty syndrome that greatly affects the quality of life of our elders. So what? So let's see what kind of a management we do for these diseases. So, like I said, healthy aging is not only about absence of disease or disability, but it is also a management of physical, sensory, and cognitive statuses. Some can be addressed with necessary changes, while some must be managed through various factors, in which periodical preventive test is one, periodical consultation is another one, being active and follow right nutrition is next factor, and they are enrolling the elderly people into disease management programs are also very necessary. So when I say periodical preventive test, the purpose is to detect any asymptomatic illness and to prevent those diseases before they become irreversible. Also, these tests play a very vital role in managing any new or a known condition. The earlier the doctors detect, the earlier the treatment is possible, and those treatments will be more effective too. So, like I said, periodical consultation, even those periodical consultations are very well taken when it is done in a regular way. So, periodical consultation also it will help in known conditions to get a better prognosis of that particular progressive diseases. For example, if there's an hypertension or diabetes are not managed well in the early stage, which will lead to another medical condition, which we call it as multi-organ dysfunction syndrome. So to avoid that, periodical preventive tests and periodical consultations will help our elderly people to take care of their health in a better way. So being active and follow right nutrition. Again, staying active helps in maintaining the healthy muscle and bone weight. At the same time, right nutrition also helps in maintaining and managing optimal health statuses. So enrolling into disease management programs will not only help our elders to take care of their health, it will also help them to bring see a lot of improvement in their health condition, and the prognosis also can be a better way. Again, having said that, the love, care, and compassion playing a very important role in managing all these persistent conditions. Let us see what kind of a red flags we see in our elderly people. So we have listed some of the common red flags over here. So example, sudden unexpected weight loss or weight gain, acute onset of severe pain, new onset of sensory loss or weakness, loss of bowel or bladder function, jaw claudication, which we call it as inability to chew the food, persistent localized headaches that awakens from sleep, reddened eye persistent for more than few days, unilateral nasal obstruction and discharge, facial and limb swelling. A proper investigation based on these persisting symptoms will definitely help in isolating the condition and take appropriate measures from the experts. So another common conditions we come across in our elderly people is osteoporosis. This is nothing but a skeletal-muscular degradation, which is a natural phenomenon with the aging. In which the bone loses density and it will become very brittle, resulting in pain, frequent fractures, and deformities. So how do we check whether they have this condition? By doing periodical DEXA scan. So these DEXA scan often used to help to diagnose any bone-related health problems such as osteoporosis, or also to assess the risk of getting the osteoporosis. So basically, it is recommended for women over 65 years and men over 70 years. So how do we correct that? By proper diet, exposure to sunlight where they get vitamin D supplement, reduction of antacids, and supplements suggested by physician, which will help in identifying and addressing with or without any underlying factors. So we also see a very common condition called muscle loss, which in medically we call it as sarcopenia, which is associated with weight loss and is common feature of aging. So proper exercise, nutrition-rich diet will definitely help in maintaining skeletal muscle and muscle of organs. So healthy muscles will reduce pressure exerted on bones and joints, which reduces cartilage damage and the risk of osteoarthritis. So maybe you all must have heard your parents saying that they have trouble sleeping. So sleeping disorder is of two types. One is primary sleep disorder, another one is secondary sleep disorder. In primary sleep disorder basically it's a factor which arises out of age. It is not related to any disease, but it happens due to age factor. So there are a few types. It is insomnia, difficulty falling asleep, sleep apnea, paused breathing while sleeping, circadian rhythm, wherein they won't be getting sleep at night, but they will be feeling sleepy in the morning hours. Non-REM sleep, which is restless, moving legs frequently, and they're getting vivid dreams. A bit of physical activity will ensure sufficient tiredness, which will urge them to take rest properly and sleep well. Unaddressed may lead to cardiometabolic diseases, that is bidirectional disorder. Another type of sleep disorder which I mentioned was secondary sleep disorder, which is associated with the medical conditions like pain, cardiovascular diseases, poor bladder control, respiratory conditions. These must be addressed in specific to prevalent condition. Sleep disorders also, it is in conjunction with mood disorders, losing memory of recent events, forgetfulness, spatial disorientation, which indicates a more or severe psychiatric problem that needs an immediate attention by the experts. So we have seen how medically it is affecting geriatric population. Now, Let's see what kind of a right nutrition will help our elderly people to overcome or to stay more healthy in their older age. Now I'm giving the slides over to you, Aarti.
Thank you, Sheetal. Good evening, everybody. So we just heard Sheetal. She has mentioned all the changes that happen in our body as we age. So now let's see how nutrition plays an important plays a role in correcting all the deficiencies or how it can slow down aging. So we observe as we age, there are a lot of changes happening in the body. For example, eyesight becomes weaker. A person may either gain weight or lose weight. He may become frailer. So here the quality of the food that they take becomes more important than the quantity. They require a more nutrient diet and not a calorie dense diet. Also, since there is reduced physical activity, there may be muscle wastage, there may be loss of bone mineral density. So the nutrient requirements should be such that they address all these deficiencies or prevent loss of all these nutrients. Next slide, please. So coming to the macronutrients, the first one is carbohydrates. Constipation is a very common complaint among the senior population. One of the reasons could be just like the other muscles of our body lose their tone, the intestinal muscles also lose their tone and become sluggish, and that could be one reason. Another reason could be reduced fiber intake. They take lesser fiber and very soft foods. Also, this could happen because of dental issues. This could be a major cause of constipation. Also, we see that there is reduced insulin sensitivity. A person wouldn't have been diabetic all his life, but suddenly, as he ages, his sugars start going up. So, a complex carbohydrate, that is a carbohydrate with good amount of fiber, will help in correcting these issues. So fiber is of two kinds. One is soluble fiber. This is the gel-like. So some fibers, when they mix with water, they form a gel-like soft substance. For example, when we cook oats, it forms a gooey substance. So this is a soluble fiber. This is especially important when the person has complaints of hemorrhoids or piles, or if he has dental issues. Also insoluble fiber, which is also important. So this you find in the bran of whole grains or the skins of vegetables and fruits. So fiber in general improves digestion, it gives better sugar control and brings down the cholesterol levels. Coming to the second macronutrients, that is total fat. At least not more than half kg per month per person is recommended. This includes cooking oils as well as the other fat sources like butter and ghee that is consumed. And along with quantity, quality is also important. So having good fats, that is fats from seeds, oils, avocados, nuts, all these contain good fats. Cycling of oils is recommended, that is frequent changing of your oils, and trying to switch to cold pressed oils or filtered oils is a good option. um, Reducing the use of refined oils and trying to stop consumption of vanaspati or the dalda, all these hydrogenated fats, because these are carcinogenic and they cause increased cardiovascular issues. Omega 3 fats play a very important role in good cardiac health, and these you will find in fish like salmon, mackerel, tuna, and for vegetarians in walnuts, flax seeds, and chia seeds. Next slide, please. So we heard Sheetal, she spoke about sarcopenia, that means loss of muscle mass, and osteoporosis, where there is loss of bone density. So to correct this, it is very or prevent these, it is very important to have good quality proteins. For non-vegetarians, this could come from eggs, lean meat, fish, and for vegetarians, there are sources like nuts and cereal pulse, protein, milk, and milk products. Um, Along with this, exercise is also very important to prevent muscle wastage. Calcium and phosphorus rich foods like milk and milk products, leafy vegetables, certain millets like ragi, amaranth, nuts like almonds or dates, all these should be a regular part of our diet. And along with that, exercise and exposure to vitamin D, and to sunlight for the vitamin D. At least 20 to 25 minutes of exposure to sunlight is important. Degeneration is a part of aging. However, it can be slowed down by consuming good amounts of antioxidants. These we find in colorful fruits and vegetables, so which are rich in vitamin A, B, C, K, potassium, vitamin E, which you get from nuts. So these have to be consumed on a regular basis to prevent age or slow down aging. Dehydration is very common among the elderly. Some reasons could be consumption of diuretics or blood pressure medicines which flush out water from the body. Diabetics need to use the washroom frequently, so that could deplete some water. People with joint pains may drink lesser water to avoid frequent trips to the bathroom. In case of digestive issues, where the person has vomiting or uh, uh, any stomach upsets, again there is loss of water, and they may forget to drink water, or they may not realize they are thirsty, so this could also be one of the reasons. And dehydration leads to various other issues like constipation. There could be electrolyte imbalance, sodium potassium imbalance, kidney problems or kidney stones, loss of balance. They may feel giddy. This could lead to falls also. Here are some tips to improve their hydration. Consumption of a glass of water before every meal or mid meal would help. Also, giving them fluids like buttermilk, milk with the meals not only looks after the hydration, it also gives them the protein, calcium, and phosphorus that they require. Consuming water containing fruits like melons or cucumbers, other leafy vegetables, all these are high in water. Reducing intake of tea and coffee or alcohol, because these flush out the water from the body. Also, keeping water at accessible places and in two or three different places in the house, so that they remember to drink water. Bathroom should also be accessible. And for those who do not feel like drinking water due to the taste, because altered taste is very common with many senior citizens. So they could have infused water, that is adding a few slices of lemon or orange or a few drops of lemon juice or some fennel seeds. This changes the flavor of water. B12 deficiency is again very common, especially among those who have been consuming metformin for a long time. So, diabetics who have been consuming metformin for a long time may have this deficiency, or those who take medication without consulting the doctor, a little burning, and they go in for antacids, or they just pop in some painkillers, certain medical conditions related to the stomach, or those who follow veganism may have this deficiency. So B12 plays a very important role in our metabolism, in our nervous system, functioning of our nervous system. So it is very important to correct this deficiency, and supplementation or injections may be required, and this should be taken with the doctor's consultation only. Loss of appetite is another symptom. This could happen because of the various medications that they take, so which cause zinc deficiency. So zinc is responsible for the sensitivity of the taste buds. Incorporating different flavors in their diet, or giving serving them food in a good environment, like a brightly lit environment, with making them eat with the family. Also, a colorful plate which looks very not only attractive, it also has all the antioxidants that they require. And small servings, so that they don't get overwhelmed looking at the big portion size, will all help in improving their appetite. Sleep is very important for our hormones and enzymes to function properly. It reduces our stress, which in turn is important for good sugar control, control of our BP, our weight, appetite. So, those suffering from sleep issues, who are not able to get sleep easily at night, can follow certain practices like switching off gadgets after 8 p.m. So, um, also having a warm water bath just before sleeping. And those having pain, body pain and joint pains, can try adding some Epsom salt to the bath water. A glass of warm milk with some nutmeg powder would help. Also, pranayama, a few rounds, maybe 8 to 10 rounds of pranayama in the dark just before sleeping, may cool down the body. um, so the gut, by gut we mean the intestines, and our gut is nothing but our second brain, because it controls a lot of functions in our body, right from controlling our sugars to blood pressure, our digestion, also our mental health. So people with poor gut health experience anxiety, depression. Their hormones are not functioning properly. The immunity may not function properly. There would be various inflammations in the body. So our gut is made up, contains a lot of bacteria, trillions of bacteria, which are called probiotics. And probiotics are actually the beneficial bacteria. These probiotics require food on a regular basis. This food is called prebiotics. And this is nothing but the fiber that we consume in our diet. Also, foods like onion, garlic, leeks, all these um, um, encourage the growth of beneficial bacteria. And there are foods which encourage the growth of the harmful bacteria, or they prevent the growth of good bacteria. So these are foods like sugar or unhealthy fats, too much caffeine, aerated drinks, alcohol, popping in of antacids, and too much stress, poor lifestyle, lack of exercise, poor sleep habits, uh, painkillers, and over sanitation. All these could are enemies of the gut bacteria. Along with diet, fitness plays a very important role. So exercising on a regular basis is very important. So exercises are of two kinds: aerobic exercises, which improve our cardiac health. They're good for our lung capacity and immunity. So zumba, walking, cycling, swimming, all these come under aerobic exercises. And resistance training, which improve our muscle mass and muscle tone and prevent muscle wastage. Some exercises can be done regularly at home to improve flexibility, to so that body pains and stiffness is reduced. So if you see in the pictures, there are ankle rolls or wrist rolls, calf raises, seated marches, bicep curls, hip stretches, side bends, and kapalabhati. All these can be done at home very easily. If there are no weights at home or dumbbells at home, one can just use filled water bottles and do these exercises, or resistant bands or elastic towels can be stretchable towels can be used. Next slide. So this is one exercise. So in today's time, many people complain that we are not able to go for a walk because of the risk of COVID. So this is something which can be done very easily, even inside the house, in your if you're living in an apartment, in your lobby, or if you have an independent house in your on your terrace, or in your compound. So walking in the shape of 8, so 15 minutes clockwise and 15 minutes anti-clockwise. This not only improves blood circulation and your cardiac health, it also helps in balancing blood pressure, reducing sugar levels, improves alertness and hand-eye coordination. It is very convenient and and can be done at any time of the day too. So coming to the benefits of exercise, exercise makes you feel better. The sleep improves. One feels looks younger also. If the people feel more physically fit, so they're independent, they feel they can independently do their daily tasks, which improves their confidence. It helps in losing weight and keeping it off also. It improves the bone muscle density and prevents frailty. Joint stability improves, flexibility improves, hence the risk of falls and fractures goes down. HDL cholesterol, which is the good cholesterol, goes up, and triglycerides and blood pressures come under control. So some tips which one can follow on a regular basis as far as diet goes is having at least 2 servings of yogurt, not the pasteurized one, the homemade one is preferred, or the unpasteurized one, fresh yogurt, and 2 servings of fruits on a regular basis, 2 different fruits, proteins and vegetables on a daily basis with all your major meals, salt and sugar with all the salt and sugar in should be controlled, and not only just the visible salt and sugar, also the salt and sugar which is added to the packaged food. So these are the invisible fat, salt, sugar, and fats. These should also be reduced. A fistful of nuts every day, cycling of oils frequently, and salads with all your meals. So, we just spoke about our nutrition and our health. Now coming to mental health. So this will be covered by Shri Hari. So over to Shri Hari. Thank you.
Thank you, Arthi and Sheetal. So here we'll commence with the mental and cognitive health. Mental and cognitive health is one of the critical aspects for us to really call ourselves healthy. So here we'll discuss on some of the common psychological issues such as depression and depressive disorders and anxiety disorders that are resultant of exposure to catabolic hormones such as cortisols, or aging, and loss of independence that would kind of withdraw from society, and also loss of a spouse who would be sort of a long-standing pillar of support, emotional support, or children moving away from for work. So these are some of the factors that would be contributing for our depression when it comes to social factors, and when it comes to our own factors, physiological factors such as diseases. Some set of diseases like hypertension, diabetes, and chronic kidney diseases will lead into depression, chronic depression, and unmanaged depression or anxiety that has a bidirectional impact on the already known condition. So thus it would be worsening the primary condition. The statistics is that about 35% of the Indian elderly population is depressed, and also there are a very high chance of dementia, population getting dementia, and proper care should be taken whenever there is a clinical or subclinical case of depression or anxiety is identified. So how do we identify the depression or anxiety is through identifying behavioral changes. So even if there are some minor behavioral changes that is persistent for a couple of weeks, we should be taking further actions. And some of the common symptoms are frequent mood swings, jitteriness, agitations, and unexplained bodily pains. That these are some of the symptoms that should not be neglected. And these behavioral changes should be brought to the notice of a treating physician if they are already undergoing any consultation. Hence, they will be able to plan or suggest a future course of action, like a psychological assessment. And in case of a clinical depression or anxiety, there would be a long-term therapy, and it would not be an one sitting treatment that is available. And if it is a subclinical, the role of family members play a large role in managing the overall condition. And how do we help our parents to cope with aging and illness-related depressive disorder and anxiety disorder is through certain common steps. So we should make them feel relevant by ensuring that their opinions matter in household decisions. We can ensure that their relevance is still counted, and to help them to be independent and carry out their own activities as long as possible, and by helping them to cope with their physical limitations and to help them functionally capable. And companionship plays a very vital role in uh, anybody's emotional status, and especially it plays a vital role in keeping an elderly population healthy. The elderly population would already be withdrawn from society, and they would not be interacting with much population, and even children would be in today's world. Children would be sort of busy with their own activities. So it is imperative that they should have a proper companionship, and a proper support structure will help them to share their emotions or shed any sense of guilt or burden if they're carrying any. And also by ensuring that their needs are taken care of with compassion, they would be made felt secure, so they would not be feeling that they're burdening somebody else. So security also plays a very vital role in ensuring a elderly person is devoid of depression or anxiety. And finally, love, care, and compassion plays a very critical role in both psychological as well as physiological disease management. So we should not be critical of their ongoing condition, and we should take care of. We should look them with care and compassion. And so now we will look into some of the critical cognitive aspects. So as we all know, body is a unison of various organs working tandemly, and with advancing age and other disease conditions like metabolic problems or renal failure or hepatic failure like hepatic failures, or any cardiovascular conditions, or even it may be unmanaged diabetes or hypertension, it will lead to a decay of neurosystem degeneration, resulting in neuronal instability and unpredictable neurotransmissions. And this will lead to a certain set of diseases called as cognitive disorders. And some of the cognitive disorders are dementia, delirium, and Alzheimer's. So with an early detection, the disease can be managed, and maintaining quality of life of elderly population for prolonged period of time would be possible. And one thing we have to keep it in mind is these diseases are progressive, and they have no known cure, and needs support for rest of their life. So without proper support, the quality of life deteriorates quickly. And if you look at some of the symptoms of cognitive diseases, if we are aware of the symptoms, we will be able to identify and intervene at the right point of time. So some of the symptoms are confusion and disorientation of time and place. So elderly population would go out, and they will not be able to find or getting ready to go out for shopping in midnight. And impairment of memory, they would not be able to recall incidents that happened recently, like whether they had their breakfast or they had been for a morning walk. So they would not be able to recall recent memory of recent events. Discontinued or unstructured thought flow also happens, so they would not be able to answer a simple question. Even for example, if we ask what is your name, they would take a while and may come back with a answer that is something different from the question that was asked. And narrating events that have never happened would also be persistent. So they would sort of withdraw, and they would display decreased activity, and they would have frequent unexplained mood swings, So they would go into perpetual confusions, or they would not be able to understand what's happening around, or sit without any communication. And frequent mood swings would also be visible, like they would start crying without any particular reason. And misplacing things and losing the ability is also one of the known symptoms. So forgetfulness happens with aging, and misplacing things where it should not be, keeping a thing where it should not be kept. These are some of the symptoms. So misplacing of things, and they would not be able to recall or justify why they have kept it somewhere else. So these are some of the critical symptoms that should be taken care of. And problem with the language speaking, and they would not be able to write. So with loss of cognition, they would not be able to comprehend and structure a sentence. Hence, like they would find it, they will come with unexplained or unknown stammering, or murmuring random unconnected words, or they would not be able to write. So, and inability to judge and withdraw from society also happens. And if any of these symptoms are found, it is imperative for to assess for a cognitive disorder by a psychological workup, so that quality of life of the elder can be maintained for a longer period of time. Next slide. So here we'll discuss about our, now we have discussed so far about psychological and physical wellness, as well as diet and activity management. And here we will come to what we are, and how we are going to treat, manage elderly population. So we offer long-term geriatric programs to manage and improve overall health of employees' parents. So we are into both, we work at both organization level as well as individual levels. And speaking of some of the salient features of our program, so we offer multidisciplinary care plans that consist of physiological, psychological, as well as diet and activity management. And regular assessments and counseling would be individually provided based on person's ailments and goals. And health improvement and milestones would be sort of planned. So we'll plan for look into outcomes, and we'll assess against outcomes in periodical manner. And regular updates would be provided to loved one or children. So with regular updates, it would be people would be able to provide better care to the elderly population. And they would also know that when there should be an intervention, or when there should be or how they're doing on regular basis. And speaking of our platform, we are one of the top 5 platforms in US, and we have been serving more than 40 million lives in US at this point of time. And also we take security as a very critical factor, wherein we are HIPAA compliant, and we have a strong data security policy. And service coverage is into care and disease management. We start comments from initial health assessment to drop an individualized plan with the multidisciplinary care plan, and the goals would be set. So disease management and counseling would be on a periodical basis, and clinical support and triaging would be done whenever required. So diet and activity, as we all know, plays a very vital role. We provide customized diet plan and clinical nutrition. Also, we draw up a personalized activity management to ensure that everyone is fit and healthy. So outcome management is also one of the critical aspect with us, and the health updates would be provided to stakeholders in a periodical manner, whether it may be to an organization indicating that how many the percentage of population who is healthy and not doing well, and individually we will share detailed inputs. So hospitalization management and value-added services at home would be some of the critical aspects that we'll be providing. So deliver lab services at home, or medication delivery at home, or home nursing, or tele and face-to-face consultations would be done. Next slide, please. So summarizing that what we have discussed so far, we have discussed about aging awareness and how the care should be provided. That includes mental health, or importance of health, nutrition and aging, and gut health, or importance of exercises. So if you have any questions about our program, about our services, we will welcome your questions to info@eldricare.com. Thank you. If you have any questions, you can type on the Facebook comments. So we would try to answer it. Questions are always welcome at info@eldricare.com. Thank you.